Hey everyone, thanks for joining me for Better Results Faster Part 3. This is going to be the final episode in the series. Thanks for hanging in there with me. So let's buckle up and dive back in. To pick up where we left off, we are going over the 3 reasons why we're in a modern day health crisis. The first reason in episode 1 was that we've lost the personal responsibility to manage our own health. Our health is going to be ours to decide for our holistic, our wellness, our maintenance care, preventative care. It is up for us to choose. In episode 2, we discussed the wrong and false definition of health and wellness. And in last episode, to recap, we discussed that the central nervous system is the master controller. This is how the brain and the body are going to connect. This is our electrical pathway, and a open flow and clear communication is going to bring about optimal health. We also talked about types of stress. We talked about what types of stresses were, and how that if our stresses become overflowing our cup, what that could lead to and what that could do to the body. To recap, the types of stresses are going to be the wheel I mentioned last time, the terrible triad in episode 2. This is going to be the trauma, toxins, and thoughts. Our traumas are going to be our physical stresses, toxins, the foods that we eat, the chemicals that we are taking in, and then our thoughts. Those negative stresses are constantly going to throw us into a subluxation. That stress, once it builds up too much, causes the subluxation condition. That subluxation condition is not only from those macro moments, but also those micro buildups. Those buildups over time is going to shift and force the spine out of its alignment, and joint misalignment is going to occur. Once this occurs, the facets are going to lock up, giving you local pain or discomfort at or near the area. Don't do anything to get that corrected, then the soft tissue damage starts to take effect. This is going to be the muscles and ligaments that attach to the spine. And not only those, but also the ligaments in between each vertebra as well start to get ripped, and the fibers start to get overstretched, overstrained, and things become loose and unstable in the spine. When things become loose and unstable, the discs start to get irritated. The discs start to get stressed out because the vertebra become locked up and not moving. Once the discs start to get stressed out, their material starts to push out and trap nervous structures around it. And these nervous structures are trapped in these small areas, and inflammation is going to start to occur. Nerves are going to start to get irritated. Once the nerves get irritated, the joint is now stuck and fixed in its position, and the muscles are starting to spasm, not knowing what's going on in the spine. The nervous system, the nervous potential is off, and the stress response has started to kick in. This stress response is now due to these pain fibers are going off like crazy, and the nerves are now so irritated that function is starting to be lost. And when function is starting to be lost, dis-ease is starting to occur. And that's when many of us that's when many of us call in and start to say that there's a problem that's got to be corrected. This flow, the nervous system is being blocked. This subluxation is blocking this nervous system potential. And that's why we have to get things moving again in the spine and get this corrected. If subluxations can happen as early as the birthing process and as early as toddler years, that's why we like to tell our patients, tell our families in our clinic that we like to get kids checked. Let's get your kids checked out, whether they're 1 to 2 days old, 1 to 2 years old, 7 years old. Let's get their spines checked. It's never too late, or it's never too early to get their power on and get their spine into alignment, to not prevent any symptoms. They're not might be having any symptoms, but to make sure that their nervous system stays in full function and flow. Here at our office, the number one condition we treat is subluxations. That's our bread and butter. That's what we diagnose. That's what we treat. And the cool thing about treating subluxations is that subluxations cause so many things in the body. So being able to locate and diagnose where a subluxation is, creating a treatment plan for it to help restore health, I don't see any better way. I want to have that be a way and have that be known and shared that it's an option to manage and control health and disease, not just a drug or a pill. Looking back at our illness and wellness continuum, neutral, a 5, is working your way down to a 0 without even knowing it. If you don't do anything to check your nervous system and see if subluxations are present. And some patients who are a 2 and know and understand that a subluxation is present start to get under care and they start to feel even worse. They're at a 0 and they're like, what happened? That's why during the first few adjustments, we always address how things may start to feel a bit more achy. Things may start to kick up some dirt. Immunity starts to kick up. But these are all responses and normal responses that you are responding to the adjustment. This response here is helping clear out the nervous system. And hopefully, sticking with care, we get from this 2, this 5 into 10, into optimal wellness. That's why we like to use this chart here at the office. And you need to ultimately decide, where do you want to land on this chart? Where do you see yourself being? How far do you want to take your health? And what health goals do you want to make and achieve? We work with that you here. We work with you here. We work with that with you here at the office. Next is here at the office to work with you and for you to come aboard our team and for us to take you under care. We have to be in agreement on how we are going to get the best results for your care. We use the 3-legged stool of adjustments here. The 3-legged stool is going to be, without one of these legs, we don't have much of a stool now, do we? So the first one is going to be adjusting in rhythm. A care plan is created for you depending on your goals, our findings, and where we're going to go with your care. A longer level of subluxation degeneration that's been around longer is going to require more time, higher frequency. Subluxation that's been around for a shorter time might require a less frequency, but we need to be able to know, is this really an acute subluxation that just happened yesterday? Or is this symptom that just happened yesterday an acute exacerbation of a much deeper, much more chronic, much more longer problem that either you or I realize? So that is why we take the x-rays and assess you at your exam and give you a report of findings. So that way we are on the same page with your level of degeneration and what's going to be required for your rhythm and frequency of adjustments. If you can't make it into being that on that rhythm and that frequency, it is ultimately your responsibility to take that care to get in here to get those adjustments in, because each adjustment is going to build on the next one. The nervous system doesn't like change. A lot of us don't like change. So things are going to want to snap right back to how they were as soon as you go right back out of the clinic after adjustment. Which brings us to our second leg, breaking bad habits. As soon as we adjust, and things are getting better, if bad habits aren't addressed and aren't analyzed, then things won't start getting the progress and the momentum that we want to see and hope. As we work together, as I continue to adjust you, as you continue to make it in here for your appointments, continue to stay under chiropractic care with us. I'll be able to learn and pick out which are the bad habits and poke and prod and see which new ones I could find to see how we could get you back to better and back to optimal. You're not alone in this. We're on a journey together. The last leg to stand on is going to be strength and exercising. I love my patients who come in with an acute condition. I am in so much pain. I can't believe this. And then after the adjustment, can I go to the gym? And I'm just like, weren't you just like an 8 out of 10? How are you going to go to the gym? So, rule of care here at our office is going to be when we're under care here and you want to go back to the gym, you will get there, but let's get you there once you're out of pain for about 2 weeks. Then you can totally start going back to the gym. Now, here at our office, going through care here, once we get to your phase 2, your phase 3, your corrective, your maintenance care, exercises will be done in the office. And of course, more exercises will be done outside of the office. But let's work together to get you out of pain, get you out of inflammation, stabilize the segments, free up those nerves so that they can start to flow and really get that signal and potential out to those target areas so that you could start doing more of the strengthening and exercising that you love. These 3 pillars, these 3 stools, these 3 legs again only work at best in rhythm together. Without one of these, then things can still get results, but how fast will we get there? Results may vary. And ultimately, we want to get there the fastest and most efficient way so that we can have optimal function and wellness continuous. So all 3 must work together. Controlling bad habits is going to be the main thing that's going to be I'm going to ask you to take care of when you're outside of the office, when you're away from the chiropractor, and when you're out there living. Life is overly stressful and overly toxic. We have to watch out for our physical stresses, our mental, and our chemical stresses. I see a lot of kids these days walking down the street face down with this huge backpack on. It leads this huge forward hedge carriage. That is a bunch of physical stress. That is going to lead to a lot of symptoms and neck pain in the future if that doesn't get corrected. So here at the office, whenever we see our kids or our older patients here with the phone like this, we do have a phone to face rule. This is going to help give you that angle, help keep that cervical curve, and help dodge neck pain in the future. How you're sleeping, stomach sleepers are a yikes. Here at the office under care, we're going to help work with your spine, help work with your posture. Hopefully, we can get you into a back sleeper. I can settle for a side sleeper. Also, how you're picking up things. I would say the older we get, watch out for a bend and a twist. I'll never forget when I was like 30. I was like, it's all downhill from here. I picked up a laundry basket to bring it up the stairs with a bend and a twist, and I swear I threw out a disc. I was like, I was a chiropractor student at the time, and I was counting down the days for me to get back to clinic so my friend could give me an adjustment to help me out, but that was miserable. So how we're picking up things, how we're moving, how we're working out, are we overtraining? Are we overrunning? Are we over conditioning? Are we under conditioning? All come into play with managing and dealing with our physical stress. Our mental stress, working out to clear our minds, how we're handling our mental stresses, how we're handling relationships, how are we handling budgeting and financing, how are we handling our money. These all things can lead up to mental stresses. Also, how are we handling our day-to-day activities? Are we waking up ready to seize the day, or are we procrastinating and dragging on our responsibilities, letting anxiety and worry build up in us? Lastly, is going to be our chemical stresses. The air we breathe, hard to dodge, but the products that we use at home in our dishwashing liquids, in our laundry, our air dispensers, our air fresheners at our house, what we're using in our foods or what foods we're eating with food coloring, and how are we dieting and nutritioning. The American diet, the sad American diet, is the standard diet for most. So, how are we managing eating out and eating processed foods? All come into play in managing our bad habits and how we're going to be able to create successful, successful, productive results here for care at our office. Before I let you guys go, I want to leave you guys off here with some tools that you'll need to help with care in and out the office. I think to start, everyone should get a foam roller. The big one, you can roll out your spine up and down about 3 to 5 minutes. Great mobility and spinal hygiene. When you're not in the office, that is going to be a little wobble ball up there that you can put in your chair, a wobble cushion, help with pelvic floor and abdominal core stability and posture, and also help my remote workers or anyone in an office job who's sitting for a long period of time. The posture pulley is going to be great here in the office. It's going to help with your cervical curve, help influence that neck curve. Cervical traction. This is going to be a traction unit you could use at home. This is going to be great 15-20 minutes a day. Some care that you could do outside of the office to help decompress your neck. Pillows can be a great way to help your posture when you sleep. A pillow is very important. Here we have cervical pillows and decor pillows that really help give you that little extra lift in the cervical curve, help reduce snoring, help increase oxygen and circulation and blood flow, get a best night's rest, get you rejuvenated for the next day. Shockwave therapy. This is going to be our version of soft tissue therapy. This is going to be getting deep into those muscles and ligaments that those chronic subluxation degenerations that might have some soft tissue issues. This is going to really help remold that scar tissue, break up adhesions, bring circulation and blood flow to the area, healing and repair. We also have the vibration plate. This is going to be helping with your posture and stability and also help reduce that forward head carriage. We put a little 3 pound, 4 pound weight in front of your forehead to help further influence that posture and curve. We have vitamins and supplements to help you with your processes and healing here at the office. Help for inflammation and really help you give it energy boost as well. So if you're looking for any supplements or homeopaths, go ahead and come to the front desk and ask about those. And then also we have spinal decompression. Spinal decompression is going to be a great way for you to hydrate and target those discs, help to really hydrate and fluid them, get them the material back into the center and off the disc. And this is also going to be help a great way to avoid any surgeries. So I want to thank you all for joining me for the Better Results Faster workshop. It's been a great pleasure to be able to share with you what we're about here at our office. I want to leave you with the last note that I do want all of you to take an action in your care. I want you to take an action to correct your problems and to prevent them, because if you don't and you just wait and procrastinate around, things won't get any better. There's no magic pill that's just going to make pain and problems go away. We have to take an action and a proactive stance to that. Here at TheLAChiropractor, we are on a mission. We're helping saving spines one life at a time. Sorry, we're helping save lives one spine at a time. And so I want to ask you, will you help us in our journey, in our mission? If there's someone you know, someone you love that can really benefit from this, and you've taken some golden nuggets away and can't remember them all to share, go ahead and send off this link. Send this to somebody who might need help and need to know that there is another way to manage their pain than a drug or a surgery. Chiropractic can be there and be that option. And I would love for them to give us a call, schedule an appointment, and we could go on that journey together. I almost forgot to tell you guys that the number 3 and the final reason why we're in this health crisis is due to procrastination. We wait and lag on things that we need to do better. And we're waiting for some check engine light to come on that is never going to come on in our spines or in our brains. We need to be proactive in our health. We need to shift the paradigm away from health is a sensation of no symptoms to health is a continuous flow of optimal wellness. And with chiropractic, we can help get your power on and your nervous system flowing at its greatest potential. So I want to thank you all for joining me. If you guys are a existing patient in the office and you're hearing this, thank you. Thank you. We love you here. We appreciate you. And for those of you who are just joining the LA Chiropractor, welcome aboard. And I can't wait to grow in your chiropractic journey with you. Now that you've completed the Better Results Faster workshop, there is going to be 5 questions sent along with this email for you to answer. And go ahead and answer them, fill them out. And at your next visit, there'll be a gift for you. It'll be your home care kit for a cervical pillow and a traction unit. Until then, I will see you at your next check-in. Dr. J is out.